Like everyone, I'm Tenzin and I'm a doctor working in the hospital in Dharamshala, India.
My name is Dawa and I work as a doctor in London.
My name is Tenzin. I'm a registered nurse at Columbia Presbyterian.
So this year has been really difficult for everyone, and the challenges that I personally faced was initially it was the mere acceptance of the fact that this problem is not something distant that's happening somewhere far away, but it's actually present next door. And being a healthcare provider, I knew that I had to be prepared and be ready to fight it.
This has been the most challenging times in nursing. We were scared of the unknown, so much so that we had to separate ourselves from our family and self-isolate in a room provided by our hospital for about 4 months. With continued search of critically ill patients and limited resources to help them, we were physically and emotionally exhausted.
Patients have been terrified to access healthcare in fears of catching corona that has actually caused a massive impact on other aspects of their health. I've had patients come to the emergency department in really critical condition, and you can see that they're fighting for their lives. And I've also had patients in the community come to the clinic after ignoring symptoms for months and months, and some of these symptoms have been quite worrying, such as cancer and other serious conditions. So you can see that catching corona can have such a fatal consequences, but also the fear of it is just having such a massive impact on the general health and well-being of our population.
So the greatest challenge throughout this time for me, it was actually to stay positive. Amidst all the fear, the anxiety, stress, and uncertainty of the future. Of course, on the work end, the workload had increased and it took a little bit of time to adapt to the new working environment.
But we showed up to work and we were determined to beat this virus.
I'm extremely grateful and thankful for my family's support throughout this time. Because of their support, I feel that I was able to cope up with these challenges.
My family and friends have been true support system for me. I would also like to thank the Tibetan community here in New York, New Jersey for reaching out to the healthcare workers and providing us with meals. We also have opportunity to talk to a therapist at work, which I think is a great tool for healthcare workers to have an outlet.
In terms of how we've tried to help cope with this challenge is that our healthcare system has adapted to be having a lot of telephone and video clinics so that patients can get in contact with us. We can give them advice over the phone, or we can arrange investigations for them, or we can bring them to see us face to face in a much more structured and safe way. And if we do feel they need to go to hospital, we can encourage them to do that.
One of the most important lessons that I take away from this year is to pay attention to not just your physical health, but your mental well-being as well. And to be grateful that you have good health and a job.
Being a Buddhist, you're always told and you hear about the impermanent nature of things. But this year I realized its significance. That nothing is permanent in life, anything can happen to you at any time, and so therefore instead of always planning about the future, I realized how important it is to live in the moment, to enjoy the present time and appreciate all the little things in life.
I think that we really do need to be kind to each other and our community, and I think that extends to the Tibetan community as well. I was in India from January to April this year, volunteering at Jamyang in Belagupi, and unfortunately we had some patients who were unwell who we wanted further advice for, and actually we didn't necessarily think they had coronavirus, but unfortunately rumours spread like wildfire, pictures were being sent around, and just putting yourself in that patient's shoes, it must have been so difficult when you're feeling unwell, you're worried about your own health, and actually there's backlash and harassment from the community that you live in. So I think as a Tibetan community we really need to reflect on that and really need to improve on this, and I'm hoping it is the younger generation that will lead in this change. Tijana.
다시 들려ኝ የሚደዝጉበት ስንጋታና redeemer health and rehab la margin laga chigiyos
number lenje kunkamsa yemile sna to den sigyo ngata da new york tonjer gi nalo la ya ladon langkur gi khalowa chigin
ngaro mila loga lagayo ngata da denni canada toronto le de yo ane ngaro lega lesa yo tanda lega leana ane chala yan yar mare shaya ge to lega le de yo
먼저 그 short step라 내가 칭해 먼저 미망고 나가 유자 거기더니 거기 빨라게 한번 나가 치마주 먼저 나가 칭해 망고디래 가래 컨스트라 so 거기 빨라게 한번 나가 치마주라 아니 거기 나가 칭해 망고 유스 냠도 먼저 원신은 단다 삼성 맞은 냠도 다시 나가지 치주도스 and this one is stressful do 나가 칭해
아니 다 넘버 디게 젠트네 단좀블리 용저라 강가 태던 트랙엠바 차데여레 아니 다나게 나 흥게 허 아니 셀 강가도 둥아 모모지 냐데여레 안트라 인디 조지가 다탈 돈렌 셰야르 아니 좀블리 그 키온 넘버에 멤버 넘버에 소마디 그 칼로 람테 노노게 그 소소 그 탈 아니 지 모담 팔라 파타가야 아니 카레케야 라파 용시 트레야 아니 던다선 아니 nembese야 그메 쇼야 라팔라 아니 틱 치다 콘다 셴네 아니 단다 대성 그 터니 아니 레가 레다 레겐바인 나마송
디치레 아니 탈로기 다 네염 디기 깽엘라 땡체 소소라 롭소 조 치슈디 가르테스 슈베이나 아니 남샤 균도 소소기 르다 심바니가 최된디 페미시 야고치고도 딘더선선 루심 대단다 남균의 소소기 최된 남고의 페미시 개침보르샤 삼성 이틀 넘버 스메기 투섬시로나
원진의 뜻 sabsa치고도 covid so 동과라 마스크 시어성 그야 sabsa치 야고신
감사 예민도 좀 많이 안다가 Ladakh begin on the city in Chishinbai.
Everyone, my name is Ola Boyol and I'm from Somerville, Massachusetts. I'm currently a second grade teacher here at the John F. Kennedy School.
Tangla testile Nyimila Jamyang Tenzin Payusane na yobe ani shungde maimbe chokpa ani edulif la ani chalena shiye nganju chokpa di ani phurik ta ani Himalaya phurik so lopru chola nganju shin to ne sapton teni mangwachik te shibaye.
The greatest challenge I faced as a teacher during the pandemic was the fact that I didn't get to see my students. We went remote in March and it's October and we're still remote. And I'm scared that my students are not getting the proper resources and teaching instruction that they need.
지난다 자도기 아니 롭지디 아니 다 간주기 차추보더와 아니 롭주주 도나다 잉레기 치도래야 아니 간주기 탐람 나조시 당한다 간다 온라인 tools 아니 리미도 망보시 아니 간주기 아니 기겐주기 아니 랑누 강조기 아니 베주치네 안도 롭지디 니 치고르와
이번에 지단에 간주 보이산에라 샤샤와이나 아니 나 타게 또 롭종 리엔다 롭종 장에디 아니 페무치라 아니 텐당보지 차디 상바야 아주 인베네 정말 아니 사정지 디samba야 아니 칼레 몽고치 때송 배차시나 아니 롭루타 기겐라 대와치야 되라야 아니 텐텐데지 네지 진주지래 아주 칼레 몽고치 때죠.
The greatest lesson I learned was that the way the pandemic has impacted communities, and as we know that the Black and Brown community is getting hit a lot harder than the white communities all around the states. So I think that something that I've learned is that we need to keep up this fight for racial equality and economic equality.
지난다 단다 딘지기 자자기 내단 qable야 당아주 순다시네 아니 소소기 삼로디 아니 상조 지키니로와 뒤쇠디 아니 툴라 아니 만주에치 야나 뒤쇠디 배주 약부시 지고에디 백케이션을 했음기도로와
아니 임베네 약외초래 샤샤이나 아니 또이 나시겐베 당아주 망고치 나라 데이드고 있잖아요. 아니 페무치지게 되네 타게도 롭좀 네다 아니 롭좀 제디 아니 다 윤데 망고 윤데 약고지 다 정말래 아니 장애기 고갑디 니 도와드리지 니 도와줘. 라서 도지